The local stories you care about. WLBB, Carrollton, News Talk, 1330, FM 106.3.
And good morning. Welcome to Community Voice. It is 8:30 a.m., Friday, September 4th. You're listening to Community Voice, and I am your host, Josh Engel. I want to take a quick moment and thank the sponsors of this program, Tanner Health System, as well as Oak Mountain Academy. Speaking of Tanner Health Systems, we have Dr. Thelma Wiley Lucas, who is a doctor at Tanner Health Center, and she is also here today to discuss colorectal cancer. I believe that you work with West Georgia Gastroenterology, correct?
I do. That is correct.
Excellent. Well, Dr. Lucas, thank you so much for joining me today.
Thank you for having me.
Excellent. Well, why don't we get right to it? Tell me a bit about yourself, your background.
Oh, boy, where do I start? I don't know how far back you want to go, but I am a gastroenterologist and hepatologist. I trained at the University of Illinois in Champaign-Urbana and worked in academic medicine for many, many years before coming here to Carrollton. So I'm in private practice at West Georgia Gastro with affiliation with Tanner Health System. And like I said, I'm a gastroenterologist as well as a hepatologist. So I see a full range of patients with all different types of diseases. So.
I see. So clearly you come from a place of experience. You've been doing this for quite a while.
I have.
So colorectal cancer has been in the news lately, given the tragic loss of Black Panther actor Chadwick Boseman. So please give us an overview of the disease. We know this is what Mr. Boseman passed away from. Would you please give us an overview of the disease, causes, symptoms, warning signs, etc.?
Sure. First of all, I, like so many other people, just absolutely shocked and saddened with the death of Chadwick Boseman, our Black Panther. Just so shocking. So on the one hand, shocking that someone so young would be diagnosed with colon cancer. On the other hand, we are starting to see cases of colon cancer in younger people. So just to answer your question, what is colon cancer? It's cancer of the colon or large intestine, which develops, usually starts in a polyp, which is an abnormal growth. And then that growth can turn cancerous. So those abnormal cells can begin to grow and sort of get out of control and form a tumor or cancer. Specifically in the case of Chadwick Boseman, at the time that he was already diagnosed as stage 3 cancer, which is advanced. You go through stage 1, stage 2, stage 3, and then stage 4 is when that cancer has spread to other places of the body. So unfortunately, at the time that he was diagnosed, he was already in an advanced stage of cancer, and he did go on to live another 4 years after being diagnosed, which is pretty amazing too. If you think back to all the work, all the movies, everything, he's been so super active over these past 4 years, but again, tragically ending in his death. So,
do we have an idea how he managed to live so long, given that lateness of the disease?
So even with stage 3, there's 3A, 3B, 3C. So they're different. So we don't know where in there he was. I would imagine what probably attributed to him being able to live so long is that he probably was otherwise healthy. He was young. He was very active. And so those things can play a part as well. So when we look at the different stages, stage 1 is when that, polyp or tumor is just right there on the inside lining of the colon. Stage 2, it starts to go through that lining, but not into the muscular layer. And then stage 3, it goes into that muscular layer. And then, like I said, there are even some stages that you can break down there. And then stage 4 is when it leaves the colon altogether. So it's eroded through all the layers. And then it can go to distant sites such as the lungs, such as the liver, the bones. That's stage 4. So
I see. Now, do we? What would you say some causes of this might be? Are there any specific causes?
There are a lot of things or risk factors that can contribute to colon cancer. One risk is age. We used to see most cancers in patients older than 60, 65 years old, so age is a risk factor. If you are African American, you have an increased risk of not only developing colon cancer, but also dying from colon cancer. We tend to think that diet or external factors can have a bearing on this. If you have a diet that's very high in animal fats, red meat, low fiber, if you're a smoker, those things can have an effect as well. Patients that have chronic inflammatory bowel disease, such as Crohn's disease or ulcerative colitis, those patients are at increased risk of developing colon cancers. And then there's a whole family of hereditary cancers that somebody may get at a very, very young age. You can have patients in their teens and 20s being diagnosed with colon cancers if they have some of these familial cancer families that they can have. So a lot of different things can go into that.
And some subgroups will have a genetic predisposition towards it anyway.
Absolutely.
I see.
Absolutely.
So how is colorectal cancer diagnosed? And I wanted to take give a quick shout out to Patsy Smith on the Facebook live stream. She said, Dr. Lucas is the best.
Oh.
I got to agree with you. She is the best. So colorectal cancer, how is it diagnosed?
So, first of all, it's diagnosed through a colonoscopy, which we'll talk more about how that's done. But basically, we'll go and take a look inside the colon with a lighted, flexible tube. And if we see these polyps, these small growths that start out benign, by identifying and removing those growths, then we can make a diagnosis that way. But before that, so that's in patients with no symptoms. We want to talk about what are some of the symptoms. What are those things that would bring a patient to the doctor so that they would undergo a colonoscopy? So some of the main symptoms are a change in bowel habits. So if you have been going along with normal bowel movements and suddenly you start to develop diarrhea, loose stools, or you may become constipated when that hasn't been an issue for you. That is a change in your bowel habits. If you're passing blood in the stool, it's never normal to see blood in the stool. So sometimes people will say, oh, it's probably hemorrhoid, and it may be, but it may not be. So it's never normal to see blood in the stool. Some people will develop abdominal swelling, bloating, swelling of the abdomen. So these are all changes, feeling fatigued, unintentional weight loss. So all of these can be symptoms of colorectal cancer. So it's important to come in to get checked if you have any of these symptoms. Now, can these be other things? Yes, they can, but these could also be symptoms of colorectal cancer. So we want to pay attention to any symptoms that you have that are new, that are unusual, that represent a change, and then you want to come in so that we can get you checked out, because it's a very easy test, very easy thing to do.
This reminds me of a poster I saw in a doctor's office when I was really young, and it said, maybe it will go away, the 5 most dangerous words in the English language. And that always stuck with me. So when you have symptoms like this and they are persistent, it's probably best not to assume that they'll go away at some point.
Right.
It's best to get checked out. Now, these biopsies you mentioned, how long would you have to wait until you got information back from that biopsy?
Usually just a few days. It might be, less than a week. That you would get the information back. So it doesn't take long at all. The important thing is that if you are having some symptoms, to get checked out and to be persistent, because part of it is on the patient, you as a patient coming in and saying, I'm having some change, I'd like to be checked out. And the other part is on us as physicians to take your symptoms seriously, to investigate. If I'm a primary care physician and that patient comes in, then to get that patient referred so that they can get checked out and not just say, oh, it's probably just this, it's probably just that. And I think that's the reason we are seeing cancer in a lot of younger people, because when they do have symptoms of bloating or some change in the bowel habits, we're more likely to attribute it to something else rather than getting that checked out. And so then by the time you come in, now you're at a more advanced stage, and the treatment options are less.
They start narrowing.
Yes.
Well, we need to take our first break, but when we come back, we're going to continue our conversation with Dr. Thelma Wiley Lucas with Tanner Health System and West Georgia Gastroenterology as we discuss colorectal cancer. Next, we'll talk about the steps following diagnosis as well as the colonoscopy process itself, so stay with us.
A well-rounded education includes much more than just academics. At Oak Mountain Academy, we encourage our students to find their niche in any of our 42 co-curricular opportunities. Over the past 5 years, we have brought home 5 state and 20 regional athletic titles. Our one-act play and literary teams continuously compete at the region and state level, and our academic teams bring home first place more than not. We are warriors creating legacies. To learn more, visit oakmountain.us.
For more than 70 years, you have turned to Tanner Health System for your healthcare needs. As our community moves forward, Tanner is here for you. Strong, safe, and close to home. Routine medical appointments, urgent elective surgeries, and imaging are back on the calendar at our hospitals and Tanner Medical Group practices. With the safety of our patients, staff, and community always our top priority. Learn more at tanner.org. #WeAreTannerStrong. That's tanner.org. #WeAreTannerStrong.
And we're back to Community Voice. I'm your host, Josh Engel. Joining me in the studio today, we have Dr. Thelma Wiley Lucas with Tanner Health System and West Georgia Gastroenterology. I'm saying that middle name right, correct, Wiley?
You are, yes.
Excellent. Good. I was hoping so. We're here today talking about colorectal cancer. You may have seen it in the news lately, given the tragic loss of the Black Panther actor Chadwick Boseman. Actually was in a lot of films. Excellent actor. This man had been struggling with colorectal cancer for several years. In fact, the good doctor mentioned earlier that he actually was diagnosed with stage 3 way before some of these movies, and it's incredible he's lasted so long. He lasted as long as he did, but we're glad because he gave us some great films. But we're talking about the cancer itself. If you're just tuning in, be sure to check out the podcast of this episode that will be uploaded to this website as well as the station's website, as well as gradicommunications.com. And we also have the Facebook live stream on our WLBB Facebook page. So if you have any questions, feel free to go back and ask some questions there. So, all right. So before we get into the colonoscopy process, what are the next steps following diagnosis?
So the next step, so Tanner has an incredible program. Once a patient has been diagnosed with cancer, there's the Tanner Cancer 3-Day. And what that is, we'll refer a patient there. And within 3 days, every test that the patient has is going to be scheduled. So if that's a CT scan of the abdomen, an appointment with one of the surgeons, if they need any kind of blood test, any other testing that's done, it's going to be done within 3 days so that we can move beyond the diagnosis to treatment in a very, very short time. So that's actually an excellent program that Tanner has. So the next step would just depend on what stage of cancer somebody is. So if someone has an early stage cancer, they may just need surgery, and that can take care of it. If someone has a later stage cancer, and depending on the location of the cancer in the colon, that patient may require surgery and chemotherapy. Like, for instance, Chadwick Boseman in stage 3, that would be surgery as well as chemotherapy. If somebody if that cancer is in the rectum, then the treatment may be radiation therapy to begin with, and then possibly surgery after that, or some patients are just treated with radiation therapy. So it depends on the stage of the cancer. It depends on the location of the cancer and the overall, general health of the patient that's involved. So those are the next steps.
I see. So let's talk about the colonoscopy process. That is
Yes.
the steps leading up to the diagnosis. We're taking a step back here, but it kind of deserves its own discussion because there's a lot involved here. Would you please take us through the colonoscopy process from prep through the sedatives that are used, the timelines here, if you would?
Absolutely. So the first thing I want to say is that it is so easy. You hear a lot of people, they are very frightened about the idea of undergoing a colonoscopy, but I do want to assure you that it is very easy. It's a very routine procedure. Some people, believe it or not, the most common complaint we get is that of the prep. So you do have to go on a diet for one day where you cannot eat any solid food. You're on a clear liquid diet, such as Jell-O, popsicles, that sort of thing. And then you do have to drink a big jug of something to get all cleaned out. We use things from Gatorade to Miralax. We let you choose your own flavor of Gatorade. So really, it's not that bad. If you can drink Gatorade, you can do this prep. Easy peasy.
Well, we had some comments on the live stream here. Folks are saying that the prep was worse than the actual procedure.
We do get
a lot
that
of folks
a lot.
say that.
We do. So one thing is drinking all of this solution that's designed to make you go to the bathroom and get all cleaned out. The other part is a lot of people just don't like the fact that they can't eat for one day. But it's just one day, people. It's one day. You can do it. So you do your prep. You come in the next day. You must have a driver with you because you're going to get some wonderful sedation. And with the sedation that is used, patients have no recollection of the procedure. It works very quickly. It reverses quickly. But because people can be a little bit buzzed afterwards, we don't want you driving. Just want you to take it easy the rest of the day. Most people leave and go to the restaurant and get something to eat or go home and take a nap. I mean, it really is a simple procedure. It takes about 20 minutes. And when we get in there with that scope, again, we are looking for polyps. We're looking for these little growths because if we see those and remove those, then that decreases your risk of colon cancer because these cancers are going to start in the polyps. So it's really a very simple procedure. It takes just a few minutes. Yes, the day before you'll suffer, but but the procedure itself is very simple, very quick, and so important, and can be life-saving.
And afterwards,
absolutely.
you could go get a steak if you felt like it.
You absolutely can.
Or some fish or something. If you're hungry.
Yes, not steak.
Not steak. Let's avoid red meat. But you can get some chicken or something.
Absolutely.
Wonderful.
Absolutely.
All right. Well, thank you, because I think that's the big thing. A lot of folks are anxious about starting that process. They're worried about the actual colonoscopy itself, let alone the diagnosis following.
Sure.
But it's kind of nice to be able to spread awareness and let folks know it's not as scary as folks think it is. Because, I mean, I know we're all going to have to do it one day. I'm going to have to do it one day.
Yes.
And that is actually leads me to my next question. When should men and women consider getting their first colonoscopy? Is there a recommended age for these sexes?
There is a recommended age. So for the general population, for patients that have no symptoms whatsoever, it is recommended that you undergo a screening colonoscopy. The recommendation is generally at age 50. However, the American Cancer Society has even recommended backing that up, to age 45. To start screening. This is with no symptoms. Now, remember we mentioned a group of patients that may have some genetic predisposition.
African Americans and...
Yeah, absolutely. So those patients should be screened absolutely at age 45 with no symptoms whatsoever. Patients that have a family history of colon cancer. So if you have a first-degree relative, a parent, a child, a sibling with colon cancer, you are at increased risk. And that patient actually needs to be screened even 10 years earlier than the age of that patient when they were diagnosed. So for instance, if your father developed colon cancer at age 40, you actually need to undergo a colonoscopy 10 years earlier at age 30. So it just depends. But for the general population, age 45 to 50 would be that initial colonoscopy. And then if we find no polyps at all, it would just be every 10 years after that.
That was my next question. The frequency of testing. So every 10 years would be
for
average.
Routine average screening with no polyps. Once we find polyps, or if you have a family history of colon cancer, then it would be every 5 years.
Now, in your personal opinion, how superior is the colonoscopy process compared to the barium enema? I believe that was a former way of doing it.
Right. So in the past, we've used barium enema. We've used a flexible sigmoidoscopy, which goes up just to see part of the colon. The barium enema can sometimes show a lump or something, but what was that stool? Was it actual polyp? And then you'll still have to go ahead and get the colonoscopy. So the colonoscopy is actually the best test for, to get a direct look at the colon. And we can also remove a polyp or take a biopsy while we're in there. With the barium enema, that is an x-ray. It's better than nothing, but the colonoscopy would definitely be superior to that. Now, if there's a reason that a person absolutely cannot undergo a colonoscopy, sure, we would want to do a barium enema or some other way to at least get a look to see if there's something going on.
Excellent. Well, we need to take our second break. When we come back, we'll continue our conversation with Dr. Thelma Wiley Lucas, doctor at Tanner Health System in West Georgia Gastroenterology, as we continue to discuss colorectal cancer. So stay with us.
For more than 70 years, you have turned to Tanner Health System for your healthcare needs. As our community moves forward, Tanner is here for you. Strong, safe, and close to home. Routine medical appointments, urgent elective surgeries, and imaging are back on the calendar at our hospitals and Tanner Medical Group practices. With the safety of our patients, staff, and community always our top priority. Learn more at tanner.org. Hashtag We Are Tanner Strong. That's tanner.org. Hashtag We Are Tanner Strong.
As a graduate of Oak Mountain Academy, I've found that my experience on the mountain prepared me beyond all expectations. As a junior at Auburn University, I approached my studies with great confidence thanks to what I learned at OMA. When I think back on my time on the mountain, I think of my teachers. Their genuine love and concern for me as a student was always evident, and now, as an adult, I still foster those relationships. I'm Carly Robinson, an Oak Mountain Academy alum. Visit oakmountain.us to see how you can offer your child an amazing opportunity to be a warrior.
And we're back to Community Voice. I am your host, Josh Engel. Joining me in the studio today, we have Dr. Thelma Wiley Lucas, MD at Tanner Health System and West Georgia Gastroenterology. We're talking about colorectal cancer. You may have seen it in the news lately. It is what our dear friend Chadwick Boseman, the Black Panther actor, he actually passed away recently due to colorectal cancer. So This has been in the news. This has been a conversation that folks have been having. So we figured it'd be great to bring in Dr. Lucas and talk about this. We were just talking about the colonoscopy process. And again, if you're just tuning in, be sure to check out the Facebook live stream that has been uploaded that's currently on our WLBB Facebook. And also you can listen to the audio podcast that will be uploaded as well. So as far as a colonoscopy, is there anyone who should not have a colonoscopy? Any prior health reasons why they couldn't?
So there are some patients that are just, unable to tolerate the prep. Sometimes we'll get patients that'll come into the hospital and they're very debilitated. They're just unable to do the prep, in which case then we would depend on a barium enema or a CT scan to see if we could see something like that. But in general, if somebody's, pretty healthy and they could drink, they can undergo the colonoscopy.
If you can drink Gatorade.
If you can drink Gatorade, you can do this.
You can do it. We believe in you.
Yes.
So now you mentioned earlier during the break here, you mentioned direct access.
Yes.
Tell us more about that.
So there's a program through Tanner where if you meet certain screening criteria, so if you're, if you have no symptoms, and let's say you're a busy executive, but you need to get this done, there's actually a phone number that you can call. They'll take some, or ask you some questions over the phone, and then you'll just show up for your colonoscopy. And so there's certain criteria that you have to meet to make sure that it is, indeed a screening colonoscopy. I had a lady just this week that showed up. I met her for the first time just before her colonoscopy. So she'd gone through the direct access program through Tanner. She'd met all of the criteria. We did her pre-screening, and I met her. We had a chat. She underwent her screening colonoscopy, and I'll see her back in 10 years. It's fantastic.
Wow, just skipped a lot of that process.
Yes.
Just for my own curiosity, how can folks find out more information about this particular program?
So they can go on the tanner.org website. The information is all there. And again, it's a very, very simple process, and especially for people that are young and healthy and busy, but you know that it's important that you get this done. Well, cut out the middleman. Let's just get it done.
Sure. Now, that's a great piece of info. So everyone that's listening, you can take advantage of that program.
Yes.
Just go to tanner.org. So I wanted to ask you this. This is one of the few cancers that physicians are able to have eyes on. Mm-hmm. Are there other cancers that you can think of where a doctor or a physician could have eyes on? And are there any other procedures that necessarily take you inside the body for that eyes on view?
Well, if you had something, in the stomach, for instance, but again, that would involve, endoscopy. But in general, this is unique in that this is one of those cancers that we could, get in there. You can see, you can do something about it, during the procedure itself. So it's kind of unique in that way. A lot of the other cancers we're going to discover by getting a CT scan or a PET scan or something like this. But this allows us to get a direct view.
Sure. Well, we have about 5 minutes left. I wanted to ask, what can listeners do to avoid colorectal cancer? Are there any specific foods they should avoid? You mentioned fiber. I know that we spoke briefly on this, but I would like to leave listeners with that one more time. What can folks do to avoid it?
Sure. So, again, one thing you want to do is get the screening. Because a lot of patients that are diagnosed with colon cancer have absolutely no symptoms whatsoever. So if you're 45 to 50 years old, irrespective of any symptoms that you have, get screened. Diet is important. So a diet high in fiber and low in fats, especially animal fats, red meat, smoking. So these are all things that we can control. So less smoking. And there have been some studies looking at whether things like aspirin or, folic acid might help. But, you should talk to your doctor about those things. Everybody's not a candidate for that. But basically, there's some lifestyle changes that we can do. Exercise. So all the stuff that we all need to be doing, eating better, eating healthier, eating less fats, less animal products, more fruit, exercising, and stop smoking. So these are things that are doable, things that we can change that will make a big difference as far as your risk of developing colon cancer.
So surprise.
Surprise.
Exercise, stay hydrated, eat fiber. I mean, these are things that we know we should be doing. Everybody knows that they should be doing that.
Absolutely.
So, but see, just another example of how doing this can curb a serious debilitating illness.
Absolutely.
I mean, that is truly devastating to have to deal with that. I did want to mention, we only have about 3 minutes left here, but Derek Newton earlier in the feed here said, hey. And
hey.
Also, we had a quick question here. What about swallowing a little camera capsule? Is that possible?
So not for the diagnosis of colon cancer, but the pill cam is amazing. We use it in patients that have anemia. And then these are patients that we've already looked down the stomach with the scope. We've done a colonoscopy. And then that little pill camera is to look to see if there's anything in the small intestines where we can't get to with our scope. So sorry, you're not going to get away from the Gatorade and the Miralax and the not eating. Sorry, you need to do the colonoscopy to diagnose colon cancer.
All right. Any final thoughts?
Just come in, get screened. Take your symptoms seriously. If there's any change in your bowel habits, bloating, weight loss, never normal to see blood in your stool. Never, ever, ever normal. I have so many patients that come in that have been passing blood for months and said, oh, it's my hemorrhoids, it's this, it's that. That's never normal. Get screened. It helps. It can save your life.
And for more information, folks can go to
tanner.org. You can also look me up, West Georgia Gastro. We're right here in town, ready.
Excellent. Well, Dr. Lucas, thank you so much for joining me today and shining a spotlight on colorectal cancer.
Thank you. Thank you so much. I appreciate it.
Excellent. And thank you for tuning in both here on the air and on Facebook Live. We'll see you next time.